Your dog paces through every thunderstorm. Your cat has been hiding more than usual. Your pet follows you from room to room, can't seem to settle, and no amount of reassurance helps. If that sounds familiar, I need you to hear something. This is not a training problem. It's not a discipline problem. And it's not your fault. What your pet has experienced is a whole body physiological condition, one that affects their digestion, their immune system, their inflammation levels, their pain, and their quality of life. And in 20 plus years of holistic pet nutrition practice, I have seen it respond remarkably well when we address it in the right way. I'm Penny Jones Napier. I'm a certified holistic pet health coach and standard process whole food specialist. This month inside the Woof Nutrition Member Circle, we are going deep on natural calming protocols. And today I want to give you the foundation. What anxiety actually is, what it looks like, why it happens, and where we start. Let's get into it. Most people think about pet anxiety in terms of behavior, the destruction, the barking, the hiding. But what's happening underneath the behavior is a nervous system that is stuck in threat response. And when a body lives in that state, chronically or repeatedly, the effects go far beyond behavior. Here's what chronic stress actually does inside your pet's body. It suppresses immune function. Anxious pets get sick more often and heal more slowly. It drives systemic inflammation, which means if your pet already has arthritis, allergies, or inflammatory bowel disease, their anxiety is actively making those conditions worse. Every single day, making those conditions worse. Every single day. Chronic stress keeps cortisol, the primary stress hormone, elevated. And elevated cortisol causes weight gain, muscle loss, skin breakdown, and hormonal disruption over time. It increases pain sensitivity. An anxious pet feels more pain more intensely than a calm one, which creates a vicious cycle in pets dealing with any kind of chronic discomfort. And long term, the research is clear. Chronic stress measurably shortens lifespan. I tell all of this not to alarm you. I tell you because understanding what's actually at stake changes how we approach this. Anxiety is not a personality quirk to manage. It is a health condition that deserves a real, whole-body response. Here's the piece that surprises almost everyone, including a lot of people who've been in the pet health world for years. 90% of your pet's serotonin, the primary calming, mood-stabilizing neurotransmitter, is not made in the brain. It's made in the gut. Your pet's gut and brain are in constant two-way communication through the vagus nerve, through the enteric nervous system, sometimes called the second brain, and though the chemical signals produced by the gut microbiome itself. This means an unhealthy gut, a dysbiotic gut, one that has been damaged by a processed diet, by antibiotics, by chronic stress itself. That gut is directly producing anxiety. And the reverse is also true. Anxiety creates gut inflammation, which worsens the gut, which worsens the anxiety. It's a loop that's genuinely hard to break without addressing both ends simultaneously. And here's why this matters so practically. Healing the gut microbiome is one of the most powerful calming interventions we have. I've seen pets whose anxiety was written off as just how they are, who transformed within weeks of getting real gut support alongside the rest of the calming protocol. The gut is where we start, always. One of the most important skills you can develop as a pet owner is learning to read anxiety early, because by the time it looks obvious, it has usually been building for a long time. In dogs, anxiety shows up in a ladder of signals, from subtle to severe. Most owners only notice when the dog is escalated to the top of that ladder. By then, the nervous system has already been in activation for a while. Here are the early, subtle signs, the ones that are easiest to miss. Lip licking when no food is present. A quick tongue flick that comes out of nowhere. Yawning repeatedly when the dog isn't tired. a slightly shorter, sharper yawn happens in response to something, not after sleep. Whale eye, where you can see the whites of the eyes because the dog is turned slightly away from something, but still watching it. Panting when it's not hot and the dog hasn't exercised. A single paw lift. Sniffing the ground suddenly out of context. These are what I call the whisper signals. They're the nervous system asking for help before it starts shouting. As anxiety escalates, pacing, inability to settle in familiar spaces, following you room to room, excessive licking of paws or surfaces, drooling without food present, and the signs we all recognize: trembling, barking, destructive behavior, especially when alone, escape attempts, avoidance, hiding. Here's something most owners completely miss. Anxiety also shows up in the body, recurring digestive upset during stressful events, chronic ear infections, poor coat quality, excessive shedding, recurring skin issues. These physical symptoms are the body's report card on how the nervous system has been doing, and they resolve when we address the root. Cats need their own conversation because they communicate stress very differently from dogs. And the biggest mistake cat owners make is missing it entirely until it's been going on for a long time. Cats are hardwired to hide vulnerability. In the wild, showing distress makes you a target. So your anxious cat is often suffering in silence, and the signals are easy to overlook. Here's what to watch for. Hiding beyond their normal preference for alone time, in new spots or for longer than usual. Over-grooming, excessive licking that leads to thinning fur or actual bald spots on the belly, inner legs, or base of the tail. Urinating outside the litter box, and I want to say this as clearly as I can, this is almost never a behavior problem. It is overwhelmingly a stress response. It deserves investigation into your cat's anxiety level and environment, not punishment. Decreased appetite or only eating and hiding. Increased vocalization at night. Tail thrashing while resting. That repetitive flick is tension, not cat personality. Sudden aggression that seems to come from nowhere. Almost always redirected fear. And here's perhaps the most important thing I will say about cats this entire month. A still, quiet, compliant cat during handling is not always a relaxed cat. It may be frozen, which is actually a high-stress physiological state, not calm. A genuinely relaxed cat has soft eyes, a loose body, and may slow blink. A frozen cat is rigid and motionless. The nervous system has hit its ceiling. Many owners, even some handlers, misread this as a well-behaved cat when the cat is in significant distress. Learning the distinction changes how you care for your cat. Before we talk about what to do, I want to address something that matters a great deal for how you approach your own pet. Understanding why they're the way they are. Genetics and breed are real factors. Herding breeds, Border Collies, Australian Shepherds, Shelties, were selectively bred for hypervigilance. That is literally in their DNA. Toy breeds were often selected for close attachment and sensitivity. These are not flaws, they are traits that come with specific nervous system tendencies. And knowing that helps us work with the animal we actually have. Early life experience is enormously influential. The critical socialization window in dogs is roughly 3 to 12 weeks. In cats, 2 to 9 weeks. What happens or doesn't happen during that window shapes how the nervous system responds to novelty and threat for the rest of the animal's life. Separation from the mother too early, stressful or chaotic breeding environments, trauma or neglect. These leave lasting neurological marks. Medical factors are where I see the most things get missed, especially in older pets. Chronic pain is one of the biggest underdiagnosed anxiety drivers in senior animals. A pet who hurts is a pet who is on edge. Hyperthyroidism in cats is a direct anxiety amplifier. It is often mistaken for a behavioral problem when it's actually a metabolic one. And cognitive dysfunction syndrome, the animal equivalent of dementia, creates anxiety in senior pets that can look entirely behavioral. And then gut health. And as we just discussed, gut dysbiosis is quietly contributing to anxiety in more pets than most owners actually realize. Understanding your pet's specific root is what makes the protocol we build for them genuinely effective. You're not just managing symptoms, you're addressing causes. So where do we start? If your pet is anxious, here's the framework I use. And I've used this for over 20 years with thousands of pets. It's a 5-layer protocol, and every layer matters. Layer 1 is nutrition, the foods that directly provide the building blocks for neurotransmitter production, gut health, and nervous system regulation. Tryptophan-rich proteins for serotonin, magnesium for GABA function, omega-3 fatty acids to reduce neuroinflammation, fermented foods to support the gut-brain axis. We cannot skip this layer and expect supplements to carry the full load. Layer 2 is targeted supplementation, L-theanine, CBD, and full-spectrum hemp, melatonin for noise phobia and dogs, adaptogenic herbs for chronic anxiety. The right supplement matched to the right anxiety type at the right dose. Layer 3 is herbal medicine, chamomile, passion flower, lemon balm, and adaptogens, with specific species, safety notes, with specific species because what works for your dog may be harmful for your cat. Layer 4 is environment, the safe space, white noise, pheromone therapy with adaptol and feel away, the predictable routine that lets an anxious nervous system finally relax into something stable. Layer 5 is behavior, bodywork, and veterinary partnership, which includes a modality I feel very strongly about called Tellington T-Touch, a hands-on bodywork method I've seen produce remarkable results in both dogs and horses, and fear-free handling principles, which I'm certified in. The principle across all 5 layers is this: each one lowers the anxiety burden a little. Together they create a nervous system that can actually rest, recover, and build real resilience. No single supplement does what the full protocol does. Your first action step before you change anything else is to establish your baseline. Have a free stress and anxiety assessment worksheet linked in the description. It takes about 20 minutes to complete and gives you a specific picture of your pet's anxiety that everything else gets built around. Download it. Do it before you buy a single supplement. If you want to go deeper and really build this out for your specific pet, this month inside the Woof Nutrition Members Circle, we are covering all 5 of these layers in detail, week by week. Week 1, which goes live today, is everything we covered in this video, plus the gut-brain science, the 4 TCVM anxiety patterns, and your full body language guide. Week 2 is the complete calming nutrition protocol. Week 3 is environment, body work, and T-Touch. Week 4 is situation-specific protocols, separation anxiety, noise phobias, vet visits, and travel. And we have 3 live Q&A sessions in July where I answer your specific questions about your specific pet. The link to join is in the description. The free assessment worksheet is also there. If this video helped you understand your pet a little better, please share it with someone who has an anxious dog or cat. This information changes things for people, and I want to reach as many animals as possible. I'll see you in the next video.